Cartilage lesions in the knee can cause pain and restrict mobility. Traditional treatments may fall short, leaving many patients without an ideal solution. There's a versatile option, the CARTIHEAL Agili-C Implant, an off-the-shelf solution for knee cartilage and osteochondral defect repair, indicated for the treatment of ICRS Grade 3 or above, with a total treatable area of 1 to 7 square centimeters with or without osteoarthritis. Designed for a broad range of knee indications, the CARTIHEAL implant features a tapered press-fit design and a unique structure to help restore more mobility for patients. The biphasic implant is comprised of aragonite, a biomaterial that is porous and biocompatible, allowing it to restore bone at the subchondral level, while the drill channels allow for cartilage repair at the level of the existing healthy cartilage. The implant is inserted in a press-fit manner. The design and philic nature of the CARTIHEAL implant allows it to absorb blood and bone marrow, resulting in mesenchymal stem cells differentiating into osteogenic cells and chondrocytes. The natural porosity of the implant is similar to that of cancellous bone, which allows it to act as a scaffold for bone restoration. Two processes occur simultaneously during biological healing: restore new bone through osteoinduction, osteoconduction, and osteotransduction, and repair cartilage. In this cartilage phase, the implant has a modified porosity created by drill channels, which helps MSCs differentiate into chondrocytes. On the surface, chondrocyte cells migrate from the surrounding native cartilage and form new cartilage. As seen in the histological images, the cartilage resulting from the CARTIHEAL Agili-C implant is high in type 2 collagen and proteoglycan, while being low in type 1 collagen. A Level 1 randomized control trial has demonstrated significant improvements in knee function and pain reduction over 4 years. The CARTIHEAL implant showed positive patient-reported outcomes across a wide range of patients, from young individuals to older adults, and for patients with cartilage lesions or mild to moderate osteoarthritis, and even patients with small focal lesions or large multi-compartmental defects. With the CARTIHEAL implant, you can repair cartilage, restore bone, and return patients to life unlimited.